Hey, welcome everybody. Dr. Bruce here for tip 25, and today's going to be short and sweet. I had a client once that I was helping to get started in practice, and this person kept wanting to start marketing, and I told him, no, we need to get ready to deliver. So we need to have it so when a person comes to your practice, you're ready to see them, because my goal is every patient that walks through your door stays for life. And if you're not ready to receive someone, you lose them, and sometimes forever, because it's kind of like going on a bad date. Imagine you go out with somebody and they just weren't the right person. You didn't like them. They didn't do anything right. They made a lot of buffoon mistakes. And then you call them later. Hey, how about trying it again? Chances are, no, I don't want to be with you. I came and visited you once. You're a jerk or whatever. So when they walk into our office, think about it. That's their first impression. And I told her, you're not ready to receive patients yet. You don't even know your fee structure is. You don't have an ability to make a recommendation. You go, it doesn't matter. Once I touch them, they're going to love me, and they'll come back forever. And that's not true. People don't come to you because of your great technique. I know that's important to you, and that's how you operate. But more importantly, they come in because you give them confidence. They're going to have a healthier and more vital life. That's really why they come. They're coming for benefits of correction, not the adjustment. So if you give a good adjustment, they may not even know what a good adjustment is. And yet, if you hurt them, they're gone. If you don't have a congruent story to have them understand why they need to return, they're gone. If you get them out of pain, they're gone. They only stay once they see the big picture. So you have to have everything in order. So the fee schedule is one thing that seems to be a big topic, along with how to get more new patients. It's like fees are a good thing. And I want to say something. It's never about the money. Yes, people will use money as an excuse. People use money as a barometer to think about it. They say that people don't make a decision under $100. If they like it, under $100, they'll do it. Over 100, they start thinking about it. Over 1,000, they think about it. Over 5,000, they think about it. There's different levels of barometer of value exchange that people will really think about. If you're getting ready to spend $100,000 on an automobile, you're going to scrutinize what you're getting. If you're spending a couple $1,000s for basic transportation, you don't really care what you got as long as it runs. You know what I'm saying? So understand that when people walk through your office, they're going to be having a values assessment in their mind over the fees and the benefit of the fees. So if you charge $5,000 for a year of care, that's not going to be a no if that makes sense to have the $5,000 spent. If you can show $20,000 in benefit, or even $5,000 in benefit, or $10,000 in benefit, they're going to basically see that $5,000 is not a bad deal. But when they walk through your door with the idea it's $50, someone told them, go see my doctor, it's $50 a crack, which I've heard that before. They come in there and they want to know how little they can get away with. Because to them, getting an adjustment it's not life savings. It's basically just trying to get rid of their neck stiffness. They don't associate the consequences of the neck stiffness to occluded nerve endings. They don't see the problem with the subluxation. They don't understand what that is. They don't understand nerve interference and how that can affect everything. They just see basically my neck's stiff, for $100 I'm done, and they'll come in. And this explains why people don't follow through with care. That's why they don't even take care. But when fees are presented in a way that is not congruent with the value of their understanding of value of the care, they're not going to take it. So understand that. Have yourself a fee schedule that makes sense. One of the things I hear all the time from people is, patients just can't afford my care. I go, really? If that's the truth, then lower your fees. I mean, if people just can't afford your care, lower your fees so they can. I'm telling you what, volume makes it up. You're much better off seeing 100 patients a day at $20 a visit than 10 people at $50. 100 patients a day, you got a lot of, especially if you're getting them better, they got friends, family to refer to, they're happy, and they'll bring more people. Volume practices, are awesome, and you don't have to have a really high fee. But more importantly, It's not about the fees, in my understanding. It's what they're getting for them. So when they come in, have your insurance verifications, good. I never give insurance valuation on the first visit. I tell them that as part of your first visit, we will give you a complimentary benefits analysis to see what or how much care your insurance will cover. So when I give my reports of findings, I've already done the assessment on the insurance. I know that my recommendations, just round figures, let's say my recommendation is a $3,000 program, and I do a verification, and I estimate that insurance company is good for maybe $1,200. I'll show them that your program here is $3,000. We verified your insurance. They're going to cover about $1,200, leaving $1,800 for you to take care of. And you can take care of that today, or you can pay that over, monthly payments. And so therefore, we're happy to bill, and they also understand that if an insurance company only kicks in $500, they kick in the rest. So in doing that, they then see that. And that's why I say that programs are a must, because if I say that you need 10 visits, and they go, my insurance only covers 8, then they're only in there for pain relief. And they're going to try to get you. Can't just 8 do it? Can't we just do it in 8? They're all about paying no money at all. But if you show them the body has broken down over time, and just like putting braces on your teeth takes 3 years to restore, a normal bite, and so with that situation, 3 years for braces on your teeth, you're going to help someone balance their spine, in 8 visits? Of course not. But if they understand that, then they'll see, instead of looking at how cheap they can get away with it, they'll look at the idea of the care, the benefit of the care, and then they make the decision in more of a mass situation. I mean, let's face it, when someone buys a car, do they say, well, let me buy a left wheel and a right wheel, and I'll just assemble it later? As I buy it, I'll put it together? Of course not. They buy the whole car. And then they make affordable payments. So with that, I have pre-planned programs. I have 5 programs that I put patients on. And if you look at your office, if you've been, especially the longer you've been in practice, the more you'll relate to this, you probably have 5 or 6 or 7 programs. Depending on a young guy, a young girl, middle-aged person, an older age person, you kind of know what you're going to do. And the question comes down to this: if you saw that person and they said, take care of me for a year, what would you do? So what I want you to do then is look at your practice right now and do a mental assessment of your clients, and think about the types of people you get and what's your average recommendation. And in those situations, what if money was no object and you were told to take care of them for a year to get them from in pain back into wellness? What would you do? And if you're honest about it, don't think about money. Just think about what you would really do if it was your mother, your father, your sister, your brother, your closest, loving relative, whatever. How would you take care of them? That's your program. Never ever put your program based on the fees. And you may want to consider, if you're always saying people can't afford my care, you might be considering not to follow the sick care model. The insurance model, these $80, $90, $100 visits are insurance model. And that's why insurance has gone away, because they couldn't afford it either. So imagine you're putting somebody on an insurance model, $90 a visit, 3 times a week. That's $270 a week for the first week. First month's almost, $1,000. And then second month's a couple thousand before. I mean, my question is, could you afford it at those high rates? You've got to be willing to serve the masses. You've got to be willing to have a fee structure that your social economic area could afford if they paid for it on 12 to 18 months monthly payments, for a year of care, and that's probably close to $3,000. My question to you is, if every patient that walked through your door paid you $3,000, would you be happy? Some people tell me, well, as long as some insurance people come in once in a while, so I can tee off on them, or get those high insurance monies. But you have to come up with a plan that would make you happy. And if they have insurance and they're going to be paying less, oh well, that's just the way the thing flies. But you're looking for the ability to have a booming practice, and that's going to be one that people can afford. And it's not per visit, it's per month. Automatic check drafts, automatic credit card drafts is the way to go. And if people are paying $2,400 a year, that's $200 a month. So at $3,000 a year for care, if they paid $200 a month, they paid over 18 months. And my numbers tell me that below $300 a month is where people are willing to pay on a monthly basis, especially if they don't write the check. So when it's automatic credit card draft or automatic check draft, it works. So in summation here, get your fee schedule clean so everyone could afford what you would recommend the average person, because the more you give, you're going to get better results, and the more results you get, the more referrals you're going to get. So it's really important to have a moderate fee schedule, affordable. They can make on monthly payments, and then if they have insurance, learn how to verify it and blend it. Put them on a program. Without a program, I understand this. People always make decisions based on their needs. So when they walk through your door and they're in a lot of pain, they have a high need. In a month, they're probably asymptomatic. If you tell them, we'll see you for 12 visits and see how you're doing, well, that communicates to their brain, see how I'm doing. In other words, see if I'm still in pain. In 12 visits, they're probably out of pain. Chiropractic rocks. I mean, we get people out of pain pretty quick. And so in 12 visits now, you bring them back, and they're happy with you. They like you. They feel better. They're ecstatic. And yet you ask them to go ahead and continue on to the corrective portion, and they're like, why? I feel great. If you didn't give them the reason to understand why long-term care is necessary, then as they get lesser and lesser pain, they get lesser and lesser need. And they're going to have lesser and lesser reach to go get it. So pre-plan programs are great, but programs of care from pain, correction, stabilization on into maintenance wellness is vital to your practice. All right, it's Bruce Parker, and I'll see you on the next video.